Assalamu alaikum and a very good morning. This is Sarah Zafar from group number 6, section A, and I am going to present a short video clip on topic entitled as Biosafety of a Healthcare Worker by PPE in COVID-19 Pandemic Situations. So let's begin with the basic introduction. The outbreak of novel coronavirus-associated acute respiratory disease called coronavirus disease 19 or COVID-19 was first detected in China in December 2019. Later on, it became a pandemic situation by spreading gradually from one country to another country and then to all over the globe. To date, uncountable number of coronavirus cases are reported from around the world and from different countries, because any country is not able to control or cope with this virus completely. For complete eradication of this virus, it is necessary to collect, study and process this virus, which is done via the rules of biosafety guidelines and the main tasks of microbiological laboratories. As we all know, COVID-19 transmission scheme is high. It may spread via droplets, direct contact with humans, and indirect contact with surfaces. Hence, for proper collection, transportation, handling and processing, something is special and essentially required for this virus. So what it is? It is PPE. So how COVID-19 is associated with PPE, and what is the safety of healthcare worker associated with PPE in COVID-19 situation? What are the benefits and what are the processing and proper use and dispose of PPE is elucidated by my next colleague Neha Imran.
Let's discuss what is PPE. PPE is just a short way to say personal protective equipment. If you are going to be a part of healthcare team, it is critically important for yourself and the safety of your patient. PPE include gloves, gowns, goggles or face shield and masks. So why is this PPE important for the healthcare team? Let's pause here for a minute and have a look on two important benefits of PPE. First of all, PPE protects you. If you are a member of healthcare team, you need a barrier between you and infectious germ. So that's the first important benefit of PPE. Second important benefit is PPE protect patient by stopping or preventing the spreading of infections. Now, if we talk about the types of PPE, it vary according to the type of precautions that are required. With contact precautions, you require a gown and gloves. But if the patient has droplet precautions, you're gonna require surgical mask within 3 feet of the patient. With airborne precautions, you require a particulate respirator, not a mask. And you also need a negative pressure isolation room wherever possible. Now let's talk about the correct way of putting PPE. First thing, you're gonna put on the gown. Next, you put on a mask or respirator, goggles or your face shield, and finish off with your gloves. We just look at the 4 pieces in order. Now let's break them down. First step is putting on the gown. Make sure the gown fully covers the torso from the neck to the knees. Then on your arms, you make sure it covers your arm to the end of the wrist and it also wraps around the back. Now, do you remember what we have to put on? Yes, the mask or a respirator. Make sure it fully covers your mouth, nose and your chin area, and also you have to press on a bridge of your nose. For mask, make sure the fit is snug to your face and below your chin, and for respirator, make sure to fit check it. You have put your gown on, your mask on, now it's time for goggles or face shield. You just have to place the goggles or shield over your face and eyes and adjust the fit. Step 4 is putting on the gloves. Pull the gloves over the wrist of the isolation gown. There you have it. Now you are ready to take care for your patient with precautions. The removal of PPE is little bit different from putting on of PPE. First you're gonna take off your gloves, then your goggles or face shield, your gown, and finally the mask or your respirator. But there is something else I want to talk about. You got to be very self aware when removing PPE. If you contaminate your hands at any point during the PPE removal, you must immediately go and wash your hands or use alcohol based sanitizer. Thank you.